My name is Jenny.C.Eddy, and I'm a child life specialist that works in the Comfort Zone, which is a pediatric sedation area at University of Vermont Children's Hospital.
And I'm Jennifer Dawson. I'm a child life specialist that works on the inpatient unit at the University of Vermont Children's Hospital. I also cover the pediatric intensive care unit and cross-cover in the emergency department.
Jen and I want to thank Vermont Family Network for allowing us the opportunity to present on a topic that we feel so passionately about: supporting children with special sensory needs across healthcare settings and in the community.
First, we want to paint a picture for you that may feel very familiar. If any of the information we convey brings up questions, comments, or emotion that you would like to share, we're open to feedback and suggestions to help guide us in our everyday work and with our future presentations. We recognize that you all are the experts on your own children, and it is our pleasure to be able to offer different ideas and techniques for implementation in your everyday lives within the community. It is our hope that you take with you at least one new idea that can support you as you continue on your journey alongside your child with a sensory sensitivity. Imagine driving a car that isn't working well. When you step on the gas, the car sometimes lurches forward and sometimes doesn't respond. When you blow the horn, it sounds blaring. The brakes sometimes slow the car, but not always. The blinkers work occasionally, the steering is erratic, and the speedometer is inaccurate. You are engaged in a constant struggle to keep the car on the road, and it is difficult to concentrate on anything else. It's no wonder children with sensory sensitivities or sensory processing disorders feel out of control, exhibit a whole host of behaviors, and have difficulty concentrating and focusing in the community. Does this experience sound familiar to you?
So what is a child life specialist, and how are they qualified to help me advocate for my child?
A child life specialist is a liaison between families and the medical team. We advocate for procedural education and support, which often helps to increase certainty and decrease anxiety. We're a guide to help facilitate opportunities for a sense of control by helping children to make plans about their upcoming procedures, which often allow for smoother outcomes. We're a support system and an educator for not only patients and caregivers, but also siblings. We specialize in the area of development and the psychosocial well-being of children. It is our goal to help children work toward homeostasis. For those of you who may not be familiar with the term homeostasis, it is the tendency to maintain a stable, relatively constant internal environment versus one that is in the state of constant disequilibrium.
Child life specialists have a minimum of a bachelor's degree in child life, human development, psychology, education, or a related field. We complete at least a 600-hour internship under direct supervision of a child life specialist. We pass a national certification exam and fulfill 60 professional development hours every 5 years. Child life can be found in or consulted to any area that supports children. For example, the inpatient unit, the PICU, radiology, pre-op in the OR, children of adult patients in the cancer center and on adult floors by referral, the outpatient clinic, the Pediatric Sedation Center where I work in the Comfort Zone, and the phlebotomy lab. We hope to grow our program by providing support to the emergency department more regularly.
We as child life specialists take into consideration the following: the child's age, the child's developmental level, his or her communication style and techniques, past experiences, coping strategies, sensory considerations, the understanding of the expected task, the learning style, and the anxiety level at baseline.
Families can use these same considerations when preparing and advocating for needs in the healthcare setting and in the community.
So Jenny and I talked about how to present this information that we want to convey to you today so that it meets the educational needs of the majority of the people attending this webinar. We chose a cycle model to represent our process and thinking about all of the aspects that go into planning a visit for a child with sensory sensitivities or a sensory processing disorder. This model is used throughout the presentation in a number of settings. We refer to the information in each circle within the cycle model as a domain. We also used a child named Parker to further convey our message. Creating a plan ahead of time with staff that's unique to your child can make a world of difference. When thinking about a healthcare experience like a trip to the hospital, pediatrician's office, dental office, and/or eye doctor, we would suggest the following domains. Past experiences. What's gone well for your child in the past? What has been difficult? If he or she is new to the experience, how does your child react in new settings with new people? The state of arousal in the medical environment. Is your child hypersensitive or hyposensitive, or a combination, depending upon the day and/or environment? What drives this change? And importantly, social emotional responsiveness, sensory processing, and communication style. For example, expressive communication. So looking at how does your child communicate his or her ideas? Receptive communication. How does your child receive and understand information? Social and pragmatic. How is it that your child uses language or interacts in social context? Sensory and perceptual. How does your child perceive the environment in terms of stimulating versus destimulating? Coping skills and techniques used elsewhere. Does your child only rely on breathing techniques, counting, self-talk, squeezing a ball or a hand to get through stressful scenarios? How about his interests and favorite toys or activities? Does your child like fire trucks, a specific type of music, a specific TV show, or a YouTube channel? Flicking the edge of a rolled-up magazine. Bring items with you that are of his interest. Would a desensitization visit be helpful in reducing anxiety by allowing your child an opportunity to see the setting ahead of time, meet the team that will be caring for him, and learning the steps and expectations of behavior? Setting up the environment to meet the needs of individuals. It is helpful to turn lights low, reduce external sounds by closing doors, reducing the amount of people that are introduced to the patient at once, etc. Is a needle procedure scheduled? Would a numbing agent or pre-medication be useful? And medical play opportunities are a big one. Would your child benefit from exploring medical supplies with all of their senses prior to seeing them for the first time and use on their bodies? Some kids like to touch and smell new items before they feel comfortable with them. What type of education would be useful? Visual, auditory, or tactile? Modeling on a superhero or a picture exchange system? Would too much information be harmful? And then finally, the plan of action. What are the choices of the child, if appropriate? What will the jobs be of everyone in the room? What coping tools and distraction items will be used? What is the stopping point in case the plan does not go as expected? You'll also notice basic strategies that we have highlighted in speech bubbles alongside the cycle models. For instance, at the dentist's office, you might plan to bring along some sunglasses, earphones, or a common photo to hang on the ceiling, and/or a stress ball to squeeze. And when thinking about educating yourselves and/or your child about an upcoming healthcare experience, please note that all medical staff should be trained to teach what they practice and support people, young and old, through difficult experiences.
Meet Parker. Parker is able to travel with us through a variety of settings in the community with special accommodations. Parker's plan is very adaptable and can help him to develop a routine as well as coping skills. Parker first visits the dentist. 5-year-old Parker has a sensory processing disorder and is preparing to get his teeth counted in his first introduction to the dentist. It is important to use words that he can understand and that will be helpful in giving him his job for the visit. So we would consider this domain a goal. A desensitization visit is planned at the end of the day to try and avoid super busy times of the office with multiple procedures happening. We would consider this domain education. Parker's mom has already shown him pictures of the dental office and of some of the equipment he might see, as well as the friendly faces of the staff. We would consider this domain education. Parker is allowed to choose a comfort item from home to bring with him, as well as his favorite sunglasses to help him with his sensitivity to light. Parker also brings his iPad from home with earphones to help with distraction and loud noises he might hear. So in this section, we would consider this comfort items, distraction items, and coping tools used. Parker's mom also brings with them a list of Parker's cues and things that he finds both soothing and challenging. Prior knowledge of this information to the staff before the desensitization visit is even better. This provides helpful information about Parker to the staff without a whole lot of backtracking and waiting time. This domain we would consider accommodations and plan.
So in this slide, we're going to take a quick break from talking about the specific community locations and focus on some of the adaptable techniques that we use to help support families in those locations.
Everyone has certain sensory preferences. As many of you know, children with a diagnosis of autism or a sensory processing disorder, formerly known as sensory integration disorder, often have difficulty receiving and responding to information that comes through the senses. Sometimes people with SPD are overly sensitive and or get overwhelmed by things in their environment, lights, sounds, smells. This is known as hypersensitivity. Others seek out additional sensory information, which is known as hyposensitivity. Some children are identified as being hyposensitive, some as hypersensitive, and others having a blend of both depending on different factors and or situations. Here are some coping tools that can be used when working with a child that is exhibiting hyposensitivity. These children display behaviors that could include a need to touch things excessively, always turning the volume very loud, constantly putting objects in the mouth, struggling with staying still for any extended period of time, and or trying to constantly seek movement stimulation. So we have some examples here of some tools that would help with visual stimulation. So interactive books with buttons or pop-outs, light wands, bubbles, VR goggles. Some auditory stimulation that we would recommend would be music, musical toys, singing, earphones. Olfactory stimulation, something like breathing, essential oils, if brought into the hospital setting, as we're not able to provide them at this point, but hopefully in the future, and chapstick. Some tactile stimulation that we can offer are fiber optics, slinkies, stress balls, fidget cubes, vibrating globes, Buzzy Bee vibrating tool, weighted blankets, or warm blankets. It's helpful to note that introducing too much stimulation all at once can backfire.
So a person experiencing hypersensitivity might appear inundated or distracted by the sound of a faint noise, smell, crowded room, or touch. Here are some coping tools that can be used when working with a child that is exhibiting hypersensitivity. It is helpful to minimize high arousal. And on this slide, you can see two examples of weighted blankets that we currently use in our hospital. One is 4 pounds and one is 10 pounds. So some other coping tools for hypersensitivity would be the low light, soft music, counting, rhythmic singing or reading, white noise. Aromatherapy is positive for some people, and the weighted blanket. The only thing we would say about the weighted blanket is that many families use them at home as part of a bedtime routine. Weighted blankets should be no more than 10% of your child's body weight to be effective and safe.
So desensitization visits are often helpful when experiencing a new setting for the first time, or one that could potentially bring on stress. A desensitization visit is one where no medical procedures take place. It is an opportunity for education, play, and exploration. Desensitization visits are created by the entire team, including you and your child. This time frame is an opportunity to talk about pain management techniques and pre-medications. More than one desensitization visit can be necessary in some cases.
It's often helpful to set up the environment in a way that is conducive to particular sensory needs. If a child is exhibiting hypersensitive behavior, we might consider the following: removing environmental triggers, choosing to choose a chair versus a stretcher, lights, having the lights be more soft versus bright, minimizing noise, ambient or quiet versus loud sporadic background noise. Space, smaller versus larger, open space, minimizing the people that are allowed in the room, allowing the child to explore environment and staff prior to approaching, and positioning is a big one. Upright position versus the flat line on the table, the supine position. Alternatively, when working with children who are exhibiting hyposensitive behavior, we might use the environment to our advantage with an I Spy game, or we might bring in some coping tools such as our bubble machines, vibrating light wands, and/or music to sing or dance in order to evoke a more positive experience by way of distraction.
Pain management agents are helpful in reducing pain during needle sticks, reducing anxiety, and building trust. There are a few options available. Sweeties is essentially sugar water that has been effectively proven to reduce pain in infants and toddlers up to 15 months. EMLA works well for children 1 year and older, but needs to be on for 1 hour and feels a little bit gooey. Fortunately, the instructions on the box say otherwise, and the cream does not come with a cover, so we oftentimes will provide families with instructions and Tegaderm to help cover it up. The other thing that you can suggest with the EMLA cream is Saran wrap or Glad Press and Seal from the grocery store if Tegaderm is not available. We've seen families use very creative strategies to keep the cream on. Cinera works well for children 3 years and older and only has to be on for 25 minutes, is not gooey, but sticky unless you take off the sticker and wrap it with Coban. So we're usually creative with that. Injectable lidocaine works instantly, but it does involve a poke that feels like a mosquito bite. So a poke for a poke. Buzzy Bee works in 2 to 3 minutes, but is very loud and vibrates. So depending on how the child feels in terms of loud noises. In summary, there are lots of different choices that can be used to numb the skin of a child who's having a needle poke and is a little bit anxious.
So a lot of our work at the hospital is with medical play and procedural education. So medical play allows for children to explore the materials ahead of time and see how they might feel on their body or what they might look like. Procedural education allows children the opportunity to learn the names and process for a procedure or task. That also allows for misconceptions to be identified and processed too. So as you can see on the slide, medical play has a lot of benefits. It gives children an opportunity to express their feelings or concern. They become familiar with the medical equipment, and it helps to increase their understanding of what will be happening. They learn and practice coping techniques. They reenact healthcare experiences. They develop feelings of mastery and communicate their fears. And this is all child facilitated. We try to be present and help with that, but it is definitely run by the child. And then procedural preparation and education is a model that helps to model desired behavior. So showing like the thermometer on the action figure on themselves or the caregiver first, giving time frames. First this will happen and then this will happen. We work with the child and family as a team to come up with a plan for the procedure. And then we simply identify the jobs of everybody in the room, including the child and the family during procedures. So squeeze the ball while mom gives you a big hug. And this is definitely adult facilitated.
There are a variety of tools that can be used to educate children about upcoming procedures. One that I use most often is modeling on action figures or dolls, or even comfort items that children bring in from home, using real medical materials minus the pokes. Another way to educate children about upcoming procedures or scenarios that they may encounter in the hospital are through the picture exchange communication system, PECS, which you may or may not have seen in the educational system. And you can see that on the top left. You can create your own with pictures and Velcro on a notebook, or you can create them online and print them off. Another way to create PEC sheets are on something called Boardmaker. A third way to educate children about what they might experience is through social stories. And you can see the one on the right. This is I'm getting a haircut. Boston Children's has a site called My Hospital Stories, which you can look up a lot of stories that have already been created, or alternatively, you can create your own and make them individualized on an app that they offer. And a fourth way is through an app called Silver Kite's Touch Chart, which apparently is supported through insurance, which is a neat option you can see down on the lower left side.
Distraction is a strategy we use to help support children through difficult and possibly anxiety-provoking experiences. Distraction looks different depending on the child's comfort level with the procedure or task, their developmental level, and/or their activity of interest. We often encourage a one-voice initiative during this process as not to overstimulate. Caregivers are encouraged to participate so that everyone in the room has a job or a role. Some children want a play-by-play about what is occurring, and others prefer not to know. This is typically a choice. So for those of you who aren't familiar with the One Voice initiative, we remind people that one voice should be heard during the procedures so that not everyone is talking at once and overstimulating the child. The need for parental involvement, educating patient before the procedure about what is going to happen, and to validate your child with your words. Offering the most comfortable, non-threatening position, individualizing your game plan, and choosing appropriate distractions to be used.
Plans created ahead of time with the whole team that will be involved with the child are very helpful. This will ensure proper communication and confidence that voices are heard and wishes identified. In order to preserve trust, encourage cooperation, and safety, it is helpful to follow through with the plan that you create as a team. If adaptation is needed, feel free to advocate for your child by asking to stop and regroup. Always helpful to follow up afterwards about how you felt the process went. What went well? What changes, if any, would you make? What was the hardest part? And the team is typically very willing to talk about processing with you. Notes about the experience and changes to the plan for the future should be noted in your child's chart for the future reference.
In summary, what can you do as a caregiver? You can offer personal information and past experiences and state of arousal in the particular setting. You can offer your child directed medical play, opportunities and education, as well as desensitization visit if necessary. Implementing the one voice policy, validating and recognizing your child's concerns. I hear you're saying this, and avoid saying, I'm sorry. Using simple, concrete explanations and child-friendly language. Make a plan. Encourage comfort positioning. Give your child a job. Example, your job is to help hold mom's hand and realistic options when possible. Limiting external stimuli and unnecessary people in the room. Breathe. Kids do best with calm, supportive adults. Alternatively, getting involved with a child's distraction. For example, singing, asking your child to look for a picture or a count to be specific. Follow up. What went well? What could be done differently next time? And I just wanted to say that, like, specifically working at our hospital, it is a teaching hospital, so oftentimes there are a number of students, residents, both nursing and physicians in the rooms, and it is okay to advocate for your child and ask that as many people step out as possible.
Back to the cycle model. When thinking about a trip to the salon or barber shop, we would suggest considering similar domains, minus the needle procedure and medical play. We know that many of you avoid hair salons, barber shops, and simply cut your child's hair at home and sometimes when your child sleeps to avoid anxiousness. Consider the above model. A pre-visit by a caregiver to look for triggers might be necessary. Making an after-hours appointment to minimize stimulation and allow for extra time could be helpful. Requesting a massage or waxing room instead of a salon chair on the floor might be useful in reducing smell and sound. A special room may also make it easier to help control the light in the space. In thinking about the coping skills domain at the salon, you can use some of the same tools that might work in the medical setting or at school, perhaps breathing techniques or distraction tools that are effective. Be sure to bring comfort items from home. It is possible with planning to go through the motions without an actual haircut through it, though it takes extra time on your schedule and willingness on the part of the staff at the salon or barbershop. A desensitization visit is a great time to take pictures for a social story that can be used for education prior to the task at hand. While providing education verbally or in the social story, identify the many sensory factors that play into the salon environment. Reminders are helpful about familiar sights, photos on the wall, spinning chairs, smell like the floral smell of shampoo, sound like hair dryer, music, or talking and laughing that you might hear when you're at the salon.
So again, this model can be applied to a visit to the mall, which is another stimulating environment in which parents of children with sensory sensitivities or a sensory processing order may choose to naturally avoid. Setting up the optimal environment may not be possible, but you could certainly prepare for the experience with a social story, bring items of comfort, providing a visual timer, and be mindful of the amount of time spent in each store or at the mall as a whole. It is certainly possible to rotate points of interest with a must-visit location and create a purpose throughout the visit. For example, a scavenger hunt for looking for the number of people wearing hats on that day is also a possibility at the mall.
So back to Parker. Parker visits the mall. Parker and his family are planning a trip to the mall to start their back-to-school shopping. So this would be considered the goal domain. Pictures of the mall were taken and shown to Parker ahead of time. So this would be education. He chooses to bring one comfort item with him, as well as noise-canceling headphones to help if he is starting to feel overwhelmed by the sounds and the busy mall atmosphere. So this would be a comfort item in coping tools domain. Depending on whether or not Parker chooses to walk or ride in a wagon, a weighted blanket is brought along. So this would be part of our comfort item domain. As part of the preparation, Parker gets to pick his job for the mall visit. This helps give him something to focus on instead of the chaos of everything else happening around him. For example, you might choose together to create a scavenger hunt type of activity. Let's find 5 stores with shoes in them, or 10 people wearing glasses. This would be considered the accommodations plan domain, coping technique, and favorite activity domains.
Considerations for a trip to the theater. If you're going to the theater, then likely you're going to programming that your child may enjoy. Did you know that the Flynn in Burlington, Vermont has sensory-friendly programming available for certain shows? This atmosphere is more accepting of the many different sensory needs that exist for children. Volunteers and families are aware that children will likely be more apt to get up during the show to take breaks, engage in sensory-friendly toys in the lobby. Noises during the show will be tolerated more than in other performances, etc. Regardless of the type of performance that you see, it is always helpful to consider the distance from the stage and the screen, the exits near you, and your child's cues. A pair of earphones is always helpful in case the performance or show is louder than anticipated. You can always keep them in your bag if necessary. Accessible snacks are also handy for not only refueling, but for built-in breaks.
So considerations for planes, trains, and long automobile rides. Long trips require lots of planning. Consider the above domains similar to the other community settings. You have likely started to notice the pattern. Burlington, Vermont has some wonderful resources. We happen to have an international airport in the center of our small city. It is quite accessible for even short visits. Some families bring their children to the airport to check out the planes taking off from the observation tower. This is a great way to introduce the airport without the stress of baggage, tickets, timing, and in and out of security lines. Again, a great time to take photos for a social story that can be used at future dates. You can think of it as a fun activity, but also as a desensitization visit. Here are a few other accommodations at our local airport. So we happen to have a yoga studio in our airport, thanks to Evolution Yoga. We have a rooftop green, which you can see on the slide. We have rocking chairs that look out over the runway. We have airport history exhibits, and we have private rooms accessible through airport operations. Somebody also mentioned that Essex Cinemas also offers sensory-friendly movies. That's great. Thank you.
I don't think I even knew about that. Now that the model has been discussed in different settings, we urge you to think of strategies that can be used to prepare for birthday parties and playground visits.
In conclusion, conclusion, it is always helpful to give medical staff and community members working with your child information about your child that is pertinent to help make the experience the most positive it can be. There are many accommodations that can be made in a variety of settings. We encourage you to advocate for your child by using a plan that works well for your family. Each plan will be unique. We have a customizable plan on our next slide that can be adapted to meet your child's needs in a variety of settings. So we wanted to share that with you.
We will follow the plan from top to bottom, highlighting the areas that might be of interest. If you would like a copy of the plan above, we are certainly willing to share so that you don't have to recreate the wheel. Alternatively, we are always willing to check out resources that families have created and are willing to share with us.
So at the top of our plan, we have focused on past experiences, and you'll notice that the same domains apply in our chart. We just made it into a sheet that you can then bring with you to a doctor's office, a dentist's office. You can bring it with you to any area in the community, hair salon that you think might be pertinent. So thinking of past experiences, we would focus on what has been difficult, what has been smooth, write it down and let us know. Thinking about the state of arousal in a particular setting. So is sight overwhelming? Is sound overwhelming? Smell or touch or taste? What are environmental triggers? What helps your child be calm, and what tools can we use? Social emotional responsiveness, sensory processing and communication style. So how does your child express communication? How do they receive and understand information? How do they interact with others? And how do they perceive the environment, and what's overstimulating? So really giving us information that can then help us tailor a plan and along with you to help us meet your child's needs. What coping skills, tools, and techniques are helpful? What tools do they already have that they can bring with them? Are they hypersensitive? Are they hyposensitive? What distraction items work well? So do you often focus on breathing at home, or do bubbles help, or counting, or singing and music? Are books helpful? What toys work well? Is a tablet a great way to receive information or to help calm your child? Or is a weighted blanket often used? What interests, activities, and favorite toys do they have? So writing those down and just giving us a sense so that before you even enter the building, we can have some things ready for you, or items that you can bring with you to your appointments. And desensitization visits, we explained that earlier in the webinar. Would that be helpful, or would that be a hindrance? Would it just be an extra visit that would be overwhelming? And would setting up the environment be helpful ahead of time? Is there a particular time of day that is better for your child? Is a big waiting room space very difficult? Is it better to have a small waiting room space, or go straight back to a room, a smaller room? Is lighting essential? So does it need to be a low light versus bright lights? Is it helpful to have less noise than more, or a white noise maker in the background? Is the temperature going to make a difference? The amount of staff involved in the care, will that make a difference? In terms of needle procedures, so if we're talking about going to a hospital visit or a doctor's visit where you know they're going to get a poke, should the child be awake and alert for that, or would it be helpful to have a pre-medication so that they can get through even walking through the door to get their poke? Would numbing their skin be helpful so they don't feel it? A comfort position perhaps on a parent's lap. Would a physical barrier be needed so they don't have to see the poke that's happening? And do they have a sweet spot that they've used in the past that we know to start with? And has education been helpful in the past? And are you willing to try to educate your child about the upcoming procedure and or visit? So would modeling with a superhero be helpful, or education with a book, or a PEX sheet, or a social story, or some sort of procedural play and exploration be helpful. And then, so filling out that information would be helpful, and also jotting down some notes on the side. Here's my plan. This is what will work well for my child.
And here we have another resource that you can share with individuals in your community that might need some further education about accommodations. And important to remember that it's adaptable, as every child's needs are different, and you know your child best. So a visual system, support and accommodations, allowing time to develop a visual map of new areas when only a few people are present. Never assuming that the child is not looking at you or the task at hand. Respecting peripheral vision. You really shouldn't insist on eye contact, and never force visual education or engagement. Monitoring for visual overstimulation and neutralize the environment. Monitoring the use of bright lights, bright shiny objects. Monitor the background visual distractions during tasks. The olfactory system, so smell. The support and accommodations you could help with are being aware and educating about smells that occur during the routine tasks. For example, being able to spend time with that child and help them to understand what is happening. Hearing, auditory system, the supports and accommodations that might help or to keep in mind are really never assuming that no response means that information is not heard and or processed. Speaking as softly and clearly as possible unless a hearing impairment has been identified. Holding back with unnecessary chatter, that's definitely not helpful. Give time for the child to process information. Eliminating unnecessary background noise by shutting doors. And then touch, tactile. Controlling our impulse to touch those for whom we are caring for. Lack of touch may be a better way of showing respect. Do not take others' withdrawal personally. It might mean protection for them. Explore the use of deep pressure and light touch to reduce pain or discomfort.
So, thank you for your time and for the opportunity to present. We're open to answering questions that you may have that have come up during the webinar, and feedback and suggestions are also welcome. We've just added some reference here at the end that we use to help create our presentation, and we hope that you enjoyed listening. A few questions have come up that we're going to start answering now, but again, feel free to add more if you think of anything. What suggestions do you have for families who have children that are nonverbal? So I would say, even though a child is nonverbal, doesn't necessarily mean that they don't understand what the information that you're trying to convey. So we still talk to children that are nonverbal. We still educate them if families are okay with that. Just to assume that they do understand, so that we're not touching their bodies without giving them information about it first. Oh, can you recommend noise canceling headphones that are not wireless? Noise canceling headphones that are not wireless. I mean,
A particular brand?
I use Bose at home. I know that those are helpful.
You can typically look on Amazon too, and I know they have Bose there, as well as some cheaper or more expensive
options.
Yeah.
Are comfort animals or stuffed animals allowed at UVM Children's Hospital? Yes.
So I think that means live animals, and so especially in the inpatient world, we do have therapy dogs that come and visit at the hospital, and that was actually something we should have introduced as well, because a lot of kids can find it really therapeutic and to spend time with animals, and even just their being able to pet them, and they may have a familiar animal at home that they're interested in. I will say that it's not impossible to get your animal in the hospital. It requires a lot of work. You have to go through our infection control policy, and when you check into the hospital, you can talk to your child's nurse, who will then talk to the charge nurse. But it's a bit of a challenge, but certainly for children that are going to be there for a longer period of time, we recognize that this can be extraordinarily helpful.
Will the slides from this presentation be available? Yes, they will be. Yes.
On the VFN website.
On the VFN website. And then how important is a parent's reaction to their child's medical needs in the child's
reaction
in what's happening? I would say definitely children pick up on any anxiety that a parent has. So if a parent is really nervous, typically we see that kids are also nervous. And so if we can build rapport with the family, oftentimes it's easier to build rapport with the child. And vice versa. If we get in there and establish a relationship with a child, usually it helps calm family members down too.
So if a parent can't make an in-person practice visit, how helpful are your YouTube videos or other visuals? So if you go on to the UVM Children's Hospital webpage, there is an interactive site that helps you to tour the hospital and gives you good reminders or things that you can bring with your child on the day of that visit. We do, and Jenny might be able to speak better about this, we do have some videos that we've created, I know, for example, a trip to have an MRI that you can also access. I'm not sure, can you tell them how to access that?
Yes, on our Child Life website, you can access the MRI videos and also on YouTube. Yep.
Right, that's another thing. We do have a bit of a Child Life website that has a lot of important tools. And then we also do simply phone visits as well. We do have some people, since we cover all of Vermont and upstate New York, we do have people coming from a distance. So we recognize that can be challenging. So we are very happy to speak with you on the phone and trying to understand a little bit more about your child and your experiences and how it can be most helpful, and then go from there depending on the needs.
And we've created some teaching books, and so we are always willing to share them via email with families ahead of time so they know exactly what to expect before they even walk in the door. Here's another question. If a parent themselves has a sensory processing challenge, how best can you help their own child who is hyposensitive or hypersensitive? That's a really great question.
That's a good question.
Yeah. So I think we would certainly help the parent in the same ways that we would help the children. This is a great example. I had a mother come in, and the first time I met her, she said to me, my child has autism and so do I. And so these are the accommodations that I need in this setting, if you are open to helping me with advocating for them. And so we absolutely helped her advocate for her needs as well as her child's.
And I think it's important that we recognize this for all families and care providers at the Children's Hospital, is that you are the best advocate for your child, and we need to be able to take care of you as well so that you can do your job of advocating for your child. Because again, we can't stress enough that you are the experts in your family and the children that you care for. We are only the liaison that can help distribute this information and make the experience a little more helpful.
And here's another suggestion of a community setting that you can think about as well, as bringing your child to the library. That's another setting in which you could use this same model.
So it's hard to know what works with my child, as something that worked a few times stopped being effective. What can I do, since I often don't know until they are melting down out in the community? That's a great question. And I guess it's also important that we recognize that that is going to happen. It's extremely common that plans need to change, things need to be adapted. And, it's very common. I'm going to let Jenny help with this, but I think one of the things that I would say is that always having a backup plan, or something that's a little different that you can try, that you've rehearsed with the child ahead of time.
That's a good point. At what age can these strategies be used, and can you use these strategies with infants, toddlers, youth, and teenagers? That's a good question. I will tell you that I start educating children at the age of 3 that are typically developing. We just change our language with how we educate children, and the verbiage that we use, and maybe the pictures that we use. But we still start very young.
I think we also, though, I know that we work closely with families, even as an infant in the hospital. What are the things that soothe your child? What are the things that scare your child? What are the things that your 2-year-old is soothed by? And teenagers as well. Again, talking about the hospital, like, again, you're putting a child in an environment that is not familiar to them at all, and looking at them development and where they're at, and helping them to understand what's happening and helping just to normalize the environment a little bit is extremely important.
What should I do if my child's doctor isn't interested in learning about or trying to support a plan to help my child's medical appointments go more smoothly? That's a really hard one. I would say you can request a child life specialist to consult with to help the doctor's appointments go more smoothly. Absolutely. We are there by your side to help advocate, support, and educate your child and siblings. That's our role. In working in a small children's hospital within a larger hospital, we do have to fight sometimes to get the care that children need, and that's our role, and we're willing to help support. But you can just be your child's best advocate and say stop when you need to stop, and regroup and come back another day if you absolutely need to.
I think, again, I know that some of you aren't from our area of the world, but I will say that most of the pediatric offices in our area have been extraordinarily supportive. And once you are always welcome to call our office. I know I handle a lot of phone calls and can help to reach out myself to speak with your child's provider. But again, it's very common that they reach out to us ahead of time and ask if there's a need that we can help with.
So the school classroom and hallways, the cafeteria and the playground are all way too challenging for my child. Do you have any suggestions for me as I try to create a plan with teachers and hopefully their classmates? My child's classmates seem to find it funny to create a loud noise to see my child's reaction. Oh, wow, yeah.
That's challenging.
Mm-hmm. I would say sitting down with the class and having a frank conversation about, everybody's has sensory needs and everybody is different, and maybe accessing books from the library to help talk to kids about differences and ways that we can help each other be successful in the environment.
I think we have reached the end of our questions. So I'd like to thank everybody for joining our webinar today. I want to remind you that we're going to be saving this on our YouTube channel, which you just Google Vermont Family Network YouTube and it'll come right up. We'll also save a PDF of the PowerPoint, and I'll put our presenters' contact information in there too, so you have that. That'll be on our website. We have more than 90 webinars on our website and YouTube channel, so you can check that out. We don't have any webinars scheduled yet for the fall, but we will be having some upcoming ones, so you can either sign up for our e-newsletter or check back on our website. We always are welcome and interested in talking to any families or anyone who has any questions. You can call us toll-free at 1-800-800-4005. Thanks again for listening and have a great day.